ICH has worked to have the environment for staff be more inclusive, more welcoming, and especially focusing on Latinx folks. We have prioritized Spanish language skills and Portuguese language skills in our hiring because we know that these are populations that our clients generally work with. We have a space every couple of weeks where we have a Spanish language lunch. So everybody in the office who speaks even a little bit of Spanish gets together, we eat lunch together, and we talk in Spanish. That kind of flips the language hierarchy.
The client is ensuring that the hospital that the patients come to have access to healthcare in their preferred language, because the hospital has 42% of the patients speaking a language primarily other than English. Bi-yearly, we will run an analysis called Erlang C, and it essentially creates a heat map that will tell us what times certain languages are being requested the most for interpreter services. So whether it's 2 p.m., 3 p.m., and 4 p.m. are really big for Spanish, or if it's maybe 3 a.m. is when Portuguese is needed the most, we'll run that analysis and then bring it back to the team, and they can try and make sure that they're appropriately staffing for the interpreter call center. Another way that we make sure language access is accessible is through provider language testing, because we know that obviously it's more welcoming to receive healthcare in a language that you are most comfortable with, and so we're lucky that the population has a lot of providers and staff who are actually part of that community and are fluent in many different languages, and so we routinely reach out to providers and say, we've noticed that you speak Spanish, would you like to get credentialed, and then you don't have to have an interpreter for the call or anything like that. And that's actually been really well received for the most part, and there's over 100 providers who are credentialed now, which is great for language access. It's just easier and a lot more comfortable for patients.
Latinx communities are feeling very under siege. It's a very hostile political climate right now, and people are afraid. So considerations for working with these populations are only asking for information that is really critical, for example. I never ask immigration status, and I don't think that I ever want to be in a position of knowing somebody's immigration status, for example. It's better if that is not information that I possess. That makes people more comfortable, and it keeps us from risky situations.
Considering that Lawrence is the city with the highest Hispanic population in Massachusetts, more than 17% of the city, it was really important to make sure that we would include pieces, for example, having some of our tools, research tools, translated in Spanish was important to try to reach the community, especially for an issue such as mental health, which again for the Hispanic community is a little bit, it has its own particular challenges related to this issue in the Hispanic community. So it was important for us to make sure that we would give a voice to this community that is so important in the town. The thing that makes me proud to be a Latinx person is feeling that I'm part of a culture that is itself a product of a mix of all different kind of cultures. So in a way, this sort of makes me feel more connected to the world. And to me, being a Hispanic or a Latinx person nowadays in the US means being part of a community that is changing the political, cultural, and social landscape of the country. So